Class, and today my topic of discussion is myopia. Now let us see what is myopia. Whenever the parallel rays of light they are incident onto the eye, they are refracted in such a way that they are focused onto the retina. Whenever they are focused in front of retina, a condition called myopia occurs. Now, just to show the concept, not formed onto the retina and it is formed in front of retina. Now the condition called myopia results. Now, just to give you a brief understanding how we are supposed to correct it. Now, as the rays of light they are converge, we need to diverge them so that they reach onto the retina, the focal point, so that a clear distinct image can be formed. Now, what can cause this condition? The first is axial, and it is the most common. In this condition, what happens? The length of the eyeball increases. As a result, the retina moves further backward and the rays of light they are focused in front of the retina. This can be the cause. Other is the curvature. In this condition, the length of the eyeball is the same, but the eyes refract the rays more so that they are focused in front of the retina rather than onto the retina. Are you guys with me? Okay. Now, then is the positional. In the positional myopia, it is produced by anterior displacement of the crystalline lens. Now the refractive power of cornea is intact, refractive power of lens is intact, and the length of the eyeball is the same. That is the normal. But there is displacement of the crystalline lens anteriorly. As a result, the image moves away from the retina. Then comes index myopia. In this condition, the refractive index, Dr. Mubashir, are you with me? Okay. Now, in index myopia, the refractive power of cornea or the lens changes. As a result, the light are focused in front of it. Or it can also be due to the excessive accommodation. Now, what are the clinical variants? First is congenital myopia, then is simple or developmental myopia, then comes the pathological or degenerative myopia. The congenital myopia, acquired myopia, that can be due to trauma or keratitis, drug induced, or any other condition that may be. It is not very common. Now, जी सर, जी सर, कौन सा सर? Consecutive myopia. The consecutive myopia develops as a result of any complication due to, it can be due to cataract or anything that causes a hazy refractive media. In that condition, it is called consecutive myopia. Congenital myopia. It is present since birth, mostly unilateral, and it is normally diagnosed at the age of 2 to 3 years. It manifests as squint if there is anisometropia, a condition when the refractive power of eyes, both the eyes, are not equal. One eye is, say, -2 and the other eye is -4. In this condition, the refractive error is called anisometropia. Then comes the simple myopia. It is developmental myopia, commonest variant, due to physiological variation in the length of the eyeball, curvature type, or genetics. Clinical presentation is same more or less in all the cases. Distant vision is blurred. Patient are mostly the students and they present with this condition. They shut half of their eyes to focus on the blackboard or any other condition. This is a indication that indicate that the patient is having myopia. Signs include prominent eyeball, anterior chamber that is deeper than the normal, pupil erection, they are sluggish. Fundi sometimes have temporal crescent, and this condition is diagnosed by retinoscopy. Then comes the pathological myopia. It is also called high myopia, for which the value should be -6. If it is -6 or above, it is called pathological myopia. Degenerative myopia, rapidly progressive error starting at the age of 5 to 10 years. High myopia in early adult life with degenerative changes. Symptoms include Prominent eyeball, cornea that is large, AC is deep, fundus has optic disc that is large and pale, myopic crescent at temporal edge, papillary crescent. In this condition, you can see the Fuchs spots. The Fuchs spots develop due to the new vascularization onto the macula, which are due to the thinning of the retina endochoroid. And now, in this diagram, you can see the disc is tilted and there is crescent formation. Now, this is a condition that happens in the myopia, and also in some cases there is posterior staphyloма, which is the thinning of the scleral showing basically due to the thinning of choroid and the retina. Now comes the treatment. The treatment includes glasses, contact lens, and refractive surgery, as mentioned by Dr. Nabil. Thank you very much.